Hi. So today I have come up with a topic which I think you probably must be knowing that this has been a growing disease nowadays in almost all the females. Okay. So the topic which I'll be talking about is polycystic ovarian syndrome, or which we call in short as PCOS. Okay. So first let us know the base. What is it? It is basically a combination of various symptoms due to certain endocrinological and metabolic disorders in premenopausal women. Till now, the scientists have not found a specific reason that why does it occur. But there are various reasons which you can together you can call that these are the etiologies which is leading to this. So mainly, if we talk, why does it shows up with the symptoms? It is mainly due to the excess of androgens and the male hormone, that is the testosterone, which is produced in huge quantity in a female, where it should be produced in normal amount. Okay, so here what are the amounts that are what are the hormones that are raised? Androgens, testosterone. These are raised in a female where it should be present in normal quantity. So first, according to the name, what does the name says? Polycystic ovarian syndrome. Let me change the color. Okay, polycystic ovarian syndrome. Polycystic means there are multiple fluid-filled cysts, or you can call it as sacs, which are formed in the ovaries. Due to the genetic factors, as we say, there are two genes, that is DENND1A gene and the THA-DA gene, which are responsible for, to some amount, if it is caused genetically, then these genes are responsible to cause the disease. Then we move on to the symptoms. How does a patient who comes to you shows up with? First, the symptom that she comes up to you with is hirsutism. What does hirsutism means? Excess growth of hair, but in which region? That is the male pattern hair growth, especially in the chin, in the upper lip, like where the males they tend to grow up, as in case of mustache or beard. In these places the females will start having hairs, okay, and they will be coarse. Then the next symptom that comes up with is acne. Then there is amenorrhea. Okay, so what amenorrhea means? The patient will be coming up with a complaint like she is not having menstruation since the irregular menstruation, like the regular cycle comes up with 28 days. She will complain she will complain you that she is not having a cycle since 2 months, 3 months, and so on. Then there is androgenic alopecia, means there will be loss of hair in a male pattern, male baldness. Okay. The second is weight gain, infertility, dyslipidemia. What does dyslipidemia means? In case of dyslipidemia, you will find increase in the LDL level, increase in the triglyceride level, and there will be decrease in the HDL level. Okay, this is called as dyslipidemia, means the lipid profile will be abnormal. Then there is weight gain, okay, as I have discussed already. Acanthosis nigricans. What does it mean? There will be dark pigmentation. There will be dark pigmentation where, especially in the neck region, okay, that is called as dark patch will be there in the neck region, which is called as the acanthosis nigricans. Then there will be insulin resistance. What will happen due to insulin resistance? There will be increase in the glucose level due to insulin resistance. Okay, so the next segment that we come up with is long-term complications. What are the long-term complications due to this? There will be diabetes mellitus. As I have said you, there will be insulin resistance. So due to insulin resistance, there will be increase in the glucose level, which will result in diabetes mellitus. Then there will be coronary artery disease, dyslipidemia, I have already discussed about it. Then there will be increased risk of endometrial cancer. I'll tell you about the reason why endometrial cancer, there is increased risk. There will be ovarian cancer and breast cancer due to endometrial hyperplasia. First, let me tell you, why does endometrial hyperplasia occur? Endometrial hyperplasia occurs when there is increased increased layers of the endometrium present. Why does it occur? It mainly occurs due to increase in the estrogen level. What happens in PCOS is, since the beginning, the amount of estrogen is already increased in your body. So what happens due to this is, due to increase in the estrogen has a negative feedback on the FSH, which is called as the follicle stimulating hormone. So as the name suggests, follicle stimulating hormone, what it says, this FSH helps in the development of a single follicle, which will grow, and it will ultimately lead to a follicle which is called as the mature follicle. And when it ruptures, at that time the ovulation occurs. But here what happens, since the estrogen is high, it has a negative feedback on FSH, so the level of FSH will decrease. So there will be no ovulation because the follicles won't grow, so there will be no ovulation. Similarly, it has a positive feedback on LH, which is called as the luteinizing hormone. So if there is a positive feedback on LH, as we all know that there is ovulation due to LH surge. What is LH surge? During the time of menstruation, due to there is a time when the level of LH will suddenly rise. But here what happens, since the estrogen is high since the beginning, the level of LH is also increased. So what will happen, since the LH is already increased since the beginning, there will be no LH surge found. Means there will be no time when there will be a sudden rise or sudden peak of the LH will be there. So that also counts as a point, that there will be no ovulation. Then, so these are the reason why ovulation doesn't occur, and infertility is a consequence of that. If there will be no ovulation, then obviously the eggs will not be formed, so there will be no egg which the sperm can fertilize, so that will ultimately lead to infertility. So here, let's come back to the segment. Due to obesity, there will be sleep apnea, non-alcoholic steatohepatitis and depression. These are the long-term complications that a patient with PCOS comes to you with. Then we talk about diagnosis. How do we diagnose that a patient is suffering from PCOS? Of course, according to the criteria, there is a criteria that we use here, that is the Rotterdam criteria. What happens to that? There are certain, according to the symptoms. As I have talked about hirsutism, excess hair growth, oligomenorrhea. What does oligomenorrhea mean? The patient will be having menses in more than 35 days. As the cycle is 28 days, but she will be having menses after 35 days, and also the amount of bleeding will be very low. Secondary dysmenorrhea. Then ultrasonography results. What does it count? In the ultrasonography results, if the ovarian volume is more than 10 cc, if the number of follicles are more than 12, and the size of follicles are 2 to 9 millimeter, and it should be less than 10 millimeter. Then we come to the treatment segment. How do we treat? First, as they say that a good doctor is someone who prescribes with less medicines. So first of all, we'll try to manage it without medicines. How do we do that? We'll ask the patient to lose weight. Then we'll ask to have the patient healthy eating habits and lifestyle modification. Nowadays, almost all women are having sedentary lifestyle. There is no physical activity. So these all are the result of that. So this will be the first step to the management. Then when we come to drugs, the first drug of choice will be OCPs, that is the oral contraceptive pills. What does it contain? It contains estrogen plus progesterone. Estrogen, what should be the dose? It should be a low dose estrogen, that is less than 20 microgram, and the progesterone, which should be third or fourth generation drugs. Why? Because When we talk about the first and second generation drugs, they have side effects like hirsutism. Here we are treating the symptom of hirsutism. So here we use mainly the third and fourth generation drug progesterones, because it has anti-androgenic properties. Here, as I said, for hirsutism, the drug of choice we use is OCPs, and the duration should be for 3 to 6 months. The second choice will be spironolactone, and the third choice will be cyproterone acetate. Then, as the long-term complication, there is infertility. So many women come to a doctor with a complaint of infertility. So here we use the ovulation inducing drugs. It's called that the PCOS is the best treatable infertility. PCOS. Why? Because we know that infertility is because of anovulation. So how can we solve it? If the woman ovulates, then there will be ovulation and she can conceive. So here we use ovulation inducing drugs like letrozole. Then there are second line of drugs like HMG, human menopausal gonadotropin, or gonadotropins. Then we have the laparoscopic ovarian drilling. Here what we do, the theca cells that are already present around the ovary, we burn it. We remove the excess of the theca cells which are present around the ovary. Then there is the pulsatile GnRH. Here it increases the level of LH, FSH and estrogen. So here the FSH level was low. We increase the level of FSH so that the follicle can grow easily. Okay. So I hope you have understood it well. I have described in a